All right. So what I want to do is quickly go through the site and show you how to get information, to show you how to enroll, and share it with your other, people in your team and prospects. And then Dr. Zinni and I are going to talk about his part of the wellness and also about how you can market this. So let me share my screen right now and we will get it going. Okay, when you go into your back office, you're going to see Xosial Wellness, and all you have to do is click on that. So simple. All right, and it's going to talk about the whole program. And what I love about this is it's really in depth. Okay, so I'm just going to go down $59.97. Guess what? That is for a family of 7. So husband and wife or partners and up to 5 children from the ages of 2 to 26. Okay, so people go, oh, is that just for one person? No, it's for all 7 of you. All right. So what does it include? It includes all your virtual doctors. We have urgent care 24/7. All right. And we have doctors that speak in multiple languages that are able to assist you. They say 15 minutes to an hour kind of a deal. That is the normal. Well, we know how long it takes when we have to, go into the hospital sometimes and wait. I like the primary care because we actually get to pick our doctors. So we get to look at all their bios and find the one that suits us. And it's always going to be in your location. Please understand this is just for the United States right now, could be coming to other countries soon. Now, once you pick your primary doctor, then you just go into and book the time you want. They're going to have all of their available times. And usually you get into a primary doctor within 3 days. We also have mental health. This is so important to so many families, what we've gone through in the last few years, etc. The children are loving this. They can get on a screen and talk to the therapist and they can work through their issues. It's all included. Now, understand all 3 of these things, every single person in the family has 1 visit per month. All right? Just add up your costs on that. Now, it says right here, because we haven't updated this, we're in the process right now, it says pharmacy care, over 1,000 essential medications. Well, guess what? It's up to 4,900 right now. Okay, so we got to get all of those added in there. And if you're talking to your primary care and he's ordering blood pressure, cholesterol, whatever it is, they're going to ship it to you free of charge. No handling, no shipping charges, absolutely nothing. Now, Dr. Zinni and Dr. Templeton in this program are also going to be doing some newsletters, updating you on different things that are going to happen. And they're also going to do a question and answer at least a couple of times a month. This is all through the compensation plan. So as you're bringing people on board, they're going to be you're going to be able to earn some, rewards from them, and they'll be able to do the same thing. So we have this program, but guess what? We also have it with Dr. Zinni. So Dr. Zinni, come and explain your part of this.
I appreciate that. So again, my passion is helping people get to the root cause. And that's what the deeper dive into Beyond Wellness is. It's diving deep into your concerns, your issues, and literally helping to cure people of diabetes, of cholesterol issues, of blood pressure. It's a journey, and it's not a pill to fix anything. It's lifestyle change. It's changing the way you think about things, how you approach things, and it's a journey. And I'm here to come alongside of you, help you to make that path easy for yourself. We're going to be posting some videos so that this way you'll have a little bit better understanding about how we can come alongside and help you with things that are outside of the traditional medicine. And we'll talk about that in a second. Thanks, Pat.
Excellent. Oh, Together, this is a perfect plan. So understand, when you get on Dr. Zinni's plan, you also have that 59.97 included. So he's going to be working with you on all of that part too. And what's a great part about this, Dr. Zinni, is, people, maybe they're talking to their primary care doctor through the virtual. They can get the records and send them to you. So you're working in conjunction with the person that they already talked to, which is absolutely fantastic. So right now, we're going to have some fun here, Dr. Zinni and I. We're going to talk about how you can market this program. So let me just stop my sharing for a second here. And this is really important to me because this is something that we all need to be marketing. I'm passionate about it because one of the things that we'll talk about is 28 million people in the United States do not have any insurance at all. Can you imagine? And so being able to offer this to the people is going to change their lives. So, Dr. Zinni, I know you have some points that you want to hit on, you know, the appointments, et cetera, on people if they have to go into a doctor's office.
Yeah. So the big issue is uninsured or underinsured or access of care. Those are the kind of big buzzwords, if you will. And you already said it, Pat. 1 in 4 people are either underinsured or uninsured. And if you think about the population in the United States, that's a significant number of people.
Mhm.
The other kind of background is that on average, it's about 31 days to get into your brick and mortar primary care. And as Pat said, it's about 3 days for this. The wait time once you get into and have an appointment is about 30 minutes. The average drive time is about 30 minutes. So when you look at the economic burden, it's about $89 billion a year in lost time. So in two of my previous career moves, I was the medical director for Gallo Winery and the medical director for Caesars Entertainment. And even though we tried to put an on-site primary care clinic, you still had access problems because people didn't want to leave the floor, leave their job to come in, or they couldn't get their prescription right then and there. They had to go to the pharmacy and wait in line at the pharmacy. So that's the access of care issue that this resolves. The other thing that happens is that people are financially strapped. So often part of that access is really a barrier because they can't afford the copay. They can't afford their medications.
Mhm.
They can't afford to take time away. So I'm just going to give you a couple more statistics. And this is really what we're trying to go after and get after. And that is the small business market. There are 34.8 million small businesses in the United States. That that comprises approximately 99% of all businesses. And a small business is less than 50 full-time equivalents. And then one other statistic I'll give you, that is about 56 million people. So there's a huge market out there. And the last thing is our target markets, because we were batting around ideas about who should we kind of market this to. So I broke it up into big groups. So there's agricultural, fitness, grocers, health service, hospitality, insurance, and organizations. So agricultural are farmers, ranchers, wineries for those people that are in or around wine industry. Fitness, of course, fitness clubs, gyms, health clubs. Grocers, we have small mom and pop groceries like Grocery Outlet
Mhm.
here around us. So health food stores, health services. You wouldn't think about this, but and it's not intuitive, but chiropractors and dentists and ophthalmologists and optometrists, they're all small private practices and they can't afford usually to provide healthcare. So if we can fill that void and give them something where there's not a high deductible, there's not a huge out of pocket for medications, then it's a big gap. Hospitality, bakeries, delis, restaurants, insurance brokers, because right now there's a push to try to weed out or segregate out the, they're called Medicare ambassadors or Medicare salespeople. So there's got to be a void there. And the last is organizations. Go to your Chamber of Commerce, go to the SBA in your community and find out where these small businesses are. Make presentations to the Knights of Columbus or the Lions Club, or get on a podcast. I just recently got booked by a podcast called Doc Lounge. So it's all out there. And the whole idea is to help people get healthy and kind of fill this void. There's a huge void in there. And as Pat said, there's anywhere from 28 to 55 million people that need help. And we need to help them. I'm sorry, Pat, that was kind of long.
Just perfect. Absolutely perfect. So I just want to hit one, because there's one sector that has a great amount of turnaround, and that is in restaurants. So because they pay them lower, it's just a big turnaround. Can you imagine if the owner was able to offer them this service? Do you not think that, the employees would stick around? But also, I'm a person on time management. I'm so big on it. If I could have my employee go into the back room, get on a computer for 15 minutes, talk to the doctor, and then pick up their medication if they need it after work. Right. I've just saved my business half a day. That is so important to me. And then what about us entrepreneurs? How many do not have any insurance at all? Or, as you said, underinsured because you can't afford it. Right. So, the market is so open for all of us. And I'm excited to be on this journey with you and the teams. And let's go for it.